Dr. Pittaway, tell us about gum disease. There are so many names out there. There are periodontitis, there are gum disease, there are gingivitis, there is periodontal disease. There's all those names out there. There's all different diseases. They're all one and the same. Tell us all about it.
Well, you forgot pyorrhea. That's what an old name for gum disease. Basically, gum disease is an issue of oral hygiene.
Can you say that?
Pardon me?
Can you say that again? What did you call that? That old name for gum disease?
An old name for gum disease is pyorrhea. Not diarrhea, but pyorrhea.
Okay.
It's a good, scary name, and I think it deserves it. It's when basically your gums are so unhealthy that the tissue, your body is considering it infected, and it just treats it as your tooth like it's a big nasty splinter in your skull, and it tries to push it out. And all the gums around there get loaded with bacteria and broken down tissue, and they get kind of stinky. It affects your health. It gets into your bloodstream. So it's a very dangerous disease that increases your risk for heart disease, strokes, and some cancers. So the beautiful thing about prevention in dentistry is that we can protect the health of our patients just by keeping their teeth cleaned on a regular basis.
Okay, so tell me, what's
disease,
the first stage of gum disease? What is it called?
Well, that would be the gingivitis.
Okay.
Is the first stage of gum disease.
What does that kind of do, and what does it feel to the patient?
Well, gingivitis is a low-grade inflammation of the gums. They become red and puffy. They bleed easily. Your body is reacting to the bacteria in the crevice around your tooth, between the tooth and the gum, and it's trying to kill it off. But it can't get to the bacteria because it's outside there on the tooth, and you end up damaging your own tissue. Gingivitis is easily reversed just by cleaning the teeth and the gums, and it's a point where damage has not occurred to the periodontal complex. The attachment is still intact. The bone is not broken down at all, and health is just a cleaning or two away because the mouth heals very quickly. Gingivitis is very common, but it's also very easily treatable.
Now, when you say cleaning, you mean cleaning with a dentist, I assume?
Well, yes. Some gingivitis can be cleared up just with a good oral hygiene and good cleaning. But if the dirt on the teeth is hardened up into what we call tartar or calculus, that's not going to come off when you brush or floss. It may be above the gum line, and you might need a little help getting that off of there. A dentist is the one that will be able to take care of that, as well as tell you how bad it is. And frequently I can tell if people are susceptible to gum disease and gingivitis and periodontitis.
Okay. So the next stage up of gingivitis, what would that be?
Well, then we get into periodontitis. And the American Association of Periodontics stage that from type 1, 2, 3, 4. 0 is health, 1 is gingivitis, 2 is early periodontitis. These are all not so bad. When we start getting into type 3 and type 4, we've got bone breaking down around the teeth. We've got the gums breaking down around the teeth. It starts to get ugly. Your teeth start to get long. Your gums start to recede. Your breath starts to smell. Your arteries start to clog up. And so as it progresses, it happens in flare-ups or episodes, and so you can get a lot of damage in a very short amount of time. And that's why it's good to get them checked regularly, keep your health up, and have good oral hygiene.
Right. Well, I bet it also costs quite a bit of more money to fix it once it is advanced and needs gum surgery, right?
Well, when periodontitis becomes advanced, the treatment options get more complicated. Well, sometimes all is bad is replacing missing teeth, which are frequently lost because of gum disease. They may never have had a cavity in that tooth, but it's got to be pulled because the bone and the gums have just broken down and rotted away. And then it's not so easy to do.
Right.
But,
well, let me ask you something. It looks to me here that despite the fact that the tooth loss seems to be a big thing, of course, and it's quite expensive to replace it, and if you don't, you get your headaches and all kinds of other things. Anyway, it's obviously a big deal, and also, I guess it usually looks ugly. But from what you're telling me, the infection which is brewing right in the mouth, right at the gateway of the blood vessels, because obviously we all know that if we put something under the tongue, it goes into the blood vessels right away, which means if you have an infection here, it goes into the blood right away, and it goes to the kidney, to the liver, to the heart, to the arteries. It goes everywhere. In fact, I have heard that there was a research in Japan which says that the immune system is going so low with gum disease that, for instance, the HIV virus can and will turn into full-blown AIDS a lot easier than if you don't have gum disease. Do you agree with that?
well, absolutely, Helmut. There's a relationship between the gums and the rest of the body. When the immune system is down, the gum disease is worse. If you're diabetic and your blood sugar is off, the infection becomes worse more rapidly. And if the infection is worse, it's harder to control your blood sugar. If your immune system is low and you have a chronic infection in your mouth, it's much harder to get healthy because it's still battling that problem. If you took someone with generalized gum disease, they don't feel that lesion or infection very much in their mouth. But if you took that sore and put it on the back of their hand, it would be a hole down to the bone, covering the whole back of their hand, and they'd run to the hospital.
Right.
So it's a serious infection with bad health ramifications that is easy to treat.
Right.
Usually.
Here in California, there was a baby stillborn, because they found gum disease infection in the placenta of the mom, of the lady. Now those are isolated cases, but as you said, and I guess there's a lots of evidence that pregnant women have underweight babies if they do have gum disease in the mouth. Am I right there, or did I misunderstand that report?
No, you're right. They have established a link between periodontal disease and low preterm babies, low weight babies, also pancreatic cancer. How would you like some of that? That always feels good. So I tell my patients, floss or die. I mean, gum disease is actually a susceptibility problem, Helmut. Some people don't brush, don't floss, they eat junky food, and they never have a problem. Some people, they come to the dentist, they get their teeth cleaned, they do everything they're told, they still get bad gum disease, and it's hard to control. So a lot of it has to do with the individual as well. But the health risks are great. They find the bacteria from gum disease in people's arteries, in the placenta. It gets into the blood. It's not good for you. It raises your C-reactive protein, which is an inflammatory marker, which generates arthritis, all kinds of problems in the liver. So gum disease is a really great thing that we can treat for people to make them healthier.
So even though people maybe are genetically susceptible to it and get it or don't get it, it can be treated.
Well, yeah, absolutely. We have the standard of treatment is just cleaning the teeth really well with some anesthetic. Use a laser maybe to vaporize those bacteria down in those nasty pockets because the bacteria have invaded the gum tissue. It's hard to get it out of there. We have a Perio Protect protocol, which is a mouth guard that pushes medicine up under the gums, eliminates all the bacteria, makes the inflammation go away, makes it easier to clean the teeth, and helps reduce the need for gum surgery.
Well, wonderful. I think I should end this video simply because I should go and check my mouth, because based on what we just talked here, I don't want one of those infections in my mouth. I surely don't. All right. Bye, Dr. Pittaway.
It's too late. 85% of adults have gum disease.
All right.
So get your checkup.
That's why I go and gotta take it out. Bye-bye.